The initial evaluation on a new patient, just kind of look at some of this thoracic outlet stuff and see what's going on with it. Now let's have you balance on your right leg. Okay, good. And then balance on your left side. What you're looking for here is any type of compensation that the patient might have, any type of wiggling, extra wiggling, just really comparing side to side.
Mm-hmm.
So what did you feel in your body?
More wiggling on the right.
That's what I saw too. There's a little bit more imbalance on the right side. Okay, and you've already taken blood pressure, right?
Yes.
And you've already taken heart rate, and you can kind of see what's going on with the vascular flow on both sides of the arms.
Yes.
Okay, so we got a balance issue. Have a seat right there.
Facing this way?
Yep, facing that way. So we're gonna just go in and take a look and see what your range of motion is. Let's make sure that you are in the right frame. There we go. Okay, now let's see what your range of motion looks like. Tip your head to the right side all the way. Okay, about 50, and then to the left side all the way. Okay, 50. Look up all the way. Okay, 70, and then chin to chest. Okay, 70. So we have a little extra range of motion forward to back. Lateral flexions look good. Let's see what your rotation looks like. So rotate all the way that way. You're getting to 90 there, and then rotate all the way this way. Now do you notice that you have a small little bit of tension when you rotate to the left side? So it's very minimal, but you can tell that there's a little bit of limitation this way. It typically happens because of the tightness right through there. Okay, so we can see that that kind of matches up. You have a little bit of an imbalance impairment on this side, a little bit of tension and limitation with right rotate or with left rotation. Now, let's do some of the sensory stuff. And DTRs. Okay, so close your eyes. Now here you're looking for decrease or increase and comparative side to side. Okay, keep closed. Okay, and we can see that this side is a little bit less than this side. So you have a +1 on the right and a +2 on the left. Okay. Now looking up into the arms. Yes. Okay, good. +2 there. And good +2 there. So not too bad. Now you can come in if you find anything that's kind of off with the reflexes. You can come in, and I'll come in and do a Babinski just to kind of make sure that the toes flex. You don't want the flare, you want the flex, right?
Yes.
Now I've seen people with reduced reflexes have no response to the Babinski. And then you want to start thinking about like neuropathies and things like that.
Yeah.
Okay. So then we're going to compare vibration and temperature side to side. So I use the back end of this. It's usually pretty cold because it's aluminum. And I do it on the inside of the ankle because this is where a lot of the tibial nerves are. And so you'll get a really high read from the patient if there's a difference side to side. So this is where I'll usually use it. And if there's a finding where they are off side to side, I come out and do the lateral side of the foot typically as well. So that I'm getting multiple dermatomes, multiple myotomes involved, multiple sensory zones involved, right?
Yes, that makes sense.
Now, if you do, obviously you're going to be screening for peripheral neuropathy, so you're going to be doing the unilateral stuff, you know, like the one nerve root.
Yeah.
When we do that, I typically will do that with the toothpicks. So you come down the side, have the patient close their eyes so that they can compare inside their body. Do you notice any differences side to side? Is there any differences in poking? Okay. And I usually will come down and do the L5, S1. I'm gonna go right underneath. So I'm hitting L4, L5, and S1. So I do all the way down, and I have them compare side to side. Did you notice any differences side to side on that?
No.
Okay. Now doing the upper body, you're gonna also do the same thing. Close your eyes, come down, and you can do the hands. I do on the thumb, the middle finger, and the pinky. You wanna hit those areas to make sure that there's not any type of myotomal, dermatomal issues, right? Okay, so if all that stuff checks out, get the patient on their back. Okay, now you're going to do global muscle testing. So I typically I'll start on the side where I think they're gonna be strong, so that we can get the first read. Keep that there, which I suspect you're gonna be strong on this side, okay? Keep your hand on your stomach. Don't let me lift, good. And then we'll do an SLR here. What do you feel?
Tight hammies.
Okay, you're a cyclist. Keep your foot there. Keep it there. Now we got it on the second time. So when I'm doing muscle testing, if I find a weak muscle, I'll often test 3 times through,
Okay.
because you're looking for fatigability,
Yes.
right?
So if it's gonna be weak, it's gonna get weaker.
Yeah, it's gonna get weaker, so then you look for fatigability. You don't have fatigability on this side. Now, that's your iliacus, and usually that's the one that's kind of the weaker of the hip muscle, so it's the easiest to pick up a weakness on. Push up. This feels great. Now let's see what this side will do. Okay, keep your foot there. Now this didn't take me very much effort to really move you out of position, okay? So now I'm testing you 3 times over and it got weaker and weaker. You can feel that, okay? Push up here, okay? And so we could tell that you broke on your psoas as well. And then we're gonna check your shoulder flexion. And these are just the global big movers, like the proximal big movers, right?
Yeah.
Keep that there, because it gives us an idea of kind of what's happening with your body. Now, we see that you're globally weak on the left side, so then we can kind of infer that there may be a compression right here that's blocking the blood flow to this side of your head. There's no somatosensory deficits, which is great. Okay, now let's see you open your jaw, and there's a leftward deviation of your jaw. So the jaw will deviate to the side, or wait, let's see. I'm gonna hold your C1. And now it deviates to the right side. So remember that caveat, when you're looking at somebody's jaw, you have to hold their C1 to keep it stable. And then we can see your jaw open, yep, to the wrong side. Now I've done that sitting up with patients. When you look at somebody sitting up and you have them open up their jaw, oftentimes their head will accommodate for the jaw opening, so it'll look like their jaw's opening straight, but their head's tipping.
Okay.
Okay, so you want to make sure that you're holding that locked in when you're evaluating. Now we can see that we're going to be treating the right side shoulder based on the findings that we just found with a global left side weakness. So I'm going to pop this up to the top of the table so we can see the treatment process. Okay, let's see here. So we're going to improve the blood flow vertically. So here you're going to raise your arm to the ceiling. I'm going to come in and contact the upper aspect of the clavicle, and I'm going to pull forward and help the patient. Take a deep breath in through your nose. Have them take one big breath in so the scaling separates. Okay? Right? Now you can come in and you can do the scaling release right here. I typically will try to stay away from the vessels so that I'm working kind of closer in there and then along like the ridge line of the jaw right through here to kind of get some of those muscles to loosen up without really digging into the vascular system.
Okay.
And then keep your foot there. Markedly different.
Yeah.
Push up. Very easy, very connected. Keep your arm there. Okay, does that feel good?
Yes.
Keep your hand down. And everything's firing, right? Keep this arm up. Now, we did not go over the hand issues. So typically when you are looking for a pattern in the upper body, if we see that this shoulder is strong, we'll typically see that the hand abductors and finger extensors are weak. So once we distract that shoulder, those come back. And then same over here, we'll see this shoulder be weak and this hand be very strong. And that's usually opposite the side of the lesion. Okay?
Okay.
Let's see, is there any other questions that you have on the exam process for this? On anything we just did?
No.
Okay, now when I adjust for this type of a thing over here on this side, if we're looking at cervical adjustment, I'm going to adjust the C1 on the same side, and then I'm going to adjust the C2 to go into the rotation towards that right side, okay? same side. We want to open up the blood flow here underneath the jaw.
Yes.
You can do all different type of muscle work underneath here, the posterior digastric and the omohyoid.
Mm-hmm.
Those ones are the big strap muscles that like to compress blood flow.
Okay.
Okay?
Good to know. Yes.
Now, I typically will also adjust the upper rib. You can do the upper rib supine, or you can do it flipped over on the stomach. Let's flip you over on the stomach. Okay. Let me take those off here.
Thank you. Do you want my arm down?
No. Some patients I have to do that one just to get the alignment right,
Mm-hmm.
but
Okay.
we're just gonna do a drop table adjustment through your shoulder. Okay, big breath. And let it go. There we go. Now, because we're adjusting here and here, I will typically adjust the sacrum on the opposite side. And you'll find that you'll wanna do that to keep the spine in the right alignment. And we can see with you that your sacrum is actually twisted that way. So we're gonna set it back. Deep breath in. Now, I like to do kind of a functional test too. Pull your heel, okay, to make sure that all the muscles are working both front and back, and pull. And that we have equal strength on both sides of the body. This looks great. Cool. Now, there are a couple sets of breathing muscles. If you find that this is related to a breathing issue, you're going to want to release the serratus posterior superior and the serratus posterior inferior right through here where you can kind of feel it out.
Mm-hmm.
So I usually do MFR for that to kind of get that to open up.
Okay.
Cool?
Yeah.
Okay,
Very
cool.
Nice.
Now let's check and see what your balance looks like after we just did this. Okay, so check your right sided balance. What does
Much
it feel?
easier.
Is it?
Yeah.
Okay.
It is.
And then try your left side. Yeah, and
Yeah.
you should be super, super strong both sides.
Yeah.
And then put both hands up in front like this. And I like to just kind of check you and make sure that your balance and core is really solid.
Mhm.
You look really good right now.
Nice.
Now your rotation in your neck. No restrictions.
Yeah. Yeah.
Good.
Yeah. So
Excellent.
cool. It's
Good.
so cool.
Good. Okay.